Okay, good evening, everyone. My name is Murtaza Hassan Ali, and I'm the president-elect of ACP Council. Welcome to ACP Connect, and we're happy you're all here today. And whether you're here in audience and in person, here in Edmonton, or whether you're participating with us virtually on our YouTube channel. So welcome, everybody. So to introduce our agenda today for this evening, first, I'm going to take a look at where we are in pharmacy today. In Alberta, sharing many of the insights we have gathered in the past year from surveys that we've done with regulated members, with Albertans, and with focus groups, and we've also done a bunch of environmental scans. So I'm going to share some of that, some of those results with you here today. Next, after that, will be ACP President Patrick Zacher will take you through what we're going to do with all this information. So where is pharmacy going? And how will ACP help us get there? Patrick will walk you through ACP goals for the next 3 years and what does success look like. Then we have our ACP Registrar and CEO, Brad Wilsey, will explore how we get there, looking at our key objectives for each goal and what work ACP will get underway in the next year as our first steps. And then following some of our presentation, we'll take a short break for refreshments. For any one of you, if in between you've not catch up with supper, that'll be a good time. And then our ACP Communications Director, Barry Strader, will lead us through a panel discussion, and we'll open up the floor and the YouTube chat for questions that you may have for us. And we strongly encourage that everybody participate and ask us as many questions as you can. So before we get started, I'm going to do a land acknowledgement. The Alberta College of Pharmacy respectfully acknowledges that those of us gathered in person are on Treaty 6 territory and the Métis Region 4. And those of you participating virtually are from Treaty 6, Treaty 7, and Treaty 8 territory, the traditional lands of the First Nations people and the 6 Métis regions. The root of many modern medication come from the Indigenous people, traditional use of plants from this land. So to begin with, we're going to start with some where pharmacy practice is in Alberta. So here's what we learned from both our regulated member and our public members' experiences. So first, to provide some background, let's look at the breakdown of where we are in terms of our regulated members. So this data is current as of December 31st, 2025. So we have approximately 1,800 licensed pharmacies in Alberta. We have about 6,600 pharmacists. We have about 2,200 pharmacy technicians. We have about 4,400 pharmacists with additional prescribing authority and about 5,400 authorized to inject. That holds about 82% of pharmacists are able to inject currently in the province. And for APA, we are sitting at about 66%, or the 2/3 that I mentioned. So one of the first things I'm going to look at is what are pharmacy teams experiencing? So based on our survey of regulated members last year, this included about 900 regulated members, responded to the voluntary survey. Of that, 57% of the respondents came from pharmacists, 24% came from licensees, and 19% from pharmacy technicians. As we know, pharmacy teams face many challenges each and every day while providing quality care to Albertans. The top challenges that were revealed in our survey are, as you can see on there, about 25% of the respondents said managing the workload and burnout. 20% said addressing workforce shortages that affect the quality of care they're able to provide. And 15% said managing their scope of practice to meet the expectation of patients. This survey is just as a side note, were done by a very famous or very well-known analytics company called Leger, which you probably have heard of, does a lot of surveys for a lot of different elections and things like that. So they come from very well reputed company. This graph here, so just to give you an idea about registrants per community pharmacy. So many pharmacies in Alberta are experiencing staffing shortages, and that is definitely reflected in the statistics. As you can see, while we are seeing an increase in the number of pharmacists and pharmacy technicians in Alberta, that growth has not kept pace with the growth in pharmacies. So in 2012, community pharmacies employed approximately 3.4 pharmacists per pharmacy. That has now dropped to about 3.3 pharmacists in 2025. While we have also seen an increase in the number of pharmacy technicians per community pharmacy, since the technicians became regulated, the growth has relatively been flat since then. So looking towards the pharmacy technician frustration. Pharmacy technicians in particular are feeling a bit frustrated as a group for several reasons. They feel underused in practice despite potential to reduce pharmacists' workload. The workload and physical layout of a pharmacy can prevent full use of pharmacy technician skills. And working alongside unregulated staff confuses team roles. So clearly there are opportunities for pharmacy technicians to have more prominent role and to incorporate their full scope of practice, especially in community pharmacies. ACP's pharmacy practice consultants will tell you that the highest and the best performing community pharmacies not only have a pharmacy technician on their staff team, but also pharmacy technicians who are practicing in their full scope as well. Now, due to these challenges being experienced by pharmacy teams, many regulated members feel that it is more difficult to provide quality of care to patients than it was 5 years ago. 43% of the respondents felt that way, while 34% actually feel it's easier today than it was 5 years ago. So a little bit of half and half data there, but we can see that we for sure have some challenges there. The Net Promoter Score. This is what we call this is called, in other words, the happiness score. So question is, are you happy in your role and would you recommend this line of work to others? So one of the biggest indicators of whether people are happy in their profession is the Net Promoter Score. This measures how likely a professional is to recommend their profession to someone else. Scores for this thing range from -100 to positive 100%. Any scores above 0 is considered a good score. So for pharmacy professionals in Alberta, our Net Promoter Score is -43%. Based on the responses we collected, as you can see, only 13% of pharmacy professionals are considered promoters of their profession, while 56% are considered detractors. In our research, we also looked at the use of technology in pharmacy practice. We noticed that there has been an increase in virtual care being provided in pharmacies. Patient preferences and expectations are changing when it comes to use of technology. And new technology uses includes AI, automation, central fill pharmacies. Most reported that they have incorporated new technologies in their work and that it's made a positive impact. Interestingly, late career professionals were more likely to report that technology has negatively impacted their work. Just an important something to note there for sure, that late career professionals were more likely to report that technology has negatively impacted their work. The majority of those who have not or who haven't adopted new technologies were the earlier career professionals. So the gentlemen and ladies who have been in the career for much longer are not adopting the new technologies at this point. So that was the report from a survey for registrants. Then where are we today? This is the data that we look at from a public perception. So what does the public think about pharmacies, pharmacists, and pharmacy technicians? So our survey gathered from about 1,000 Albertans, all of whom had at least one interaction with a pharmacy team in the last year. As you can see, the vast majority of pharmacy interactions are in person, 95%, although the majority of the younger Albertans suggest that care would be easier if it occurred online. 28% of Albertans feel they have a proactive relationship with their pharmacy team. And 1 in 7 Albertans have obtained a prescription online. And among those, 46% said that they had no communication with a pharmacist. And that's a little bit worrisome for sure, but that's the data. Another public experience here was that it's interesting to note 92% of the Albertans say that they have a regular pharmacy. Of those, 66% say that they always go to their regular pharmacy, whereas 26% say they usually go to their regular pharmacy. So they will kind of hop here and there. Among the many pharmacy services received, the most common was to have a prescription for a medication from a physician, filled and dispensed, which kind of almost marks our traditional roles for most part. 72% had an existing prescription renewed or extended. 45% had a vaccine administered at a pharmacy, and 38% had a new medication prescribed by a pharmacist. Albertans reported high level of satisfaction with their pharmacy experiences, with 93% of the respondents saying they were somewhat satisfied or very satisfied. Albertans expressed positive experiences when interacting with their pharmacies, particularly related to being treated with respect, the pharmacy teams being friendly and making them comfortable, confident that they were provided with safe care and with information they understand, among others. In general, older Albertans tend to report more positive interaction, especially when compared to those under 35 years of age. The survey also found limited public understanding of pharmacists' full scope of practice when it comes to prescribing, diagnosing, and chronic condition support. The public was also asked about their awareness of different roles within the pharmacy team. So 92% of the respondents were aware of the pharmacist role, 67% were aware of the pharmacy assistant's role, and 64% were aware of the pharmacy technician role. It's interesting to also note that out of that population, only 18% were aware of the pharmacist role. The public also expressed that the roles within pharmacy teams were unclear to them. We also asked survey participants about the medical profession they trust the most. While family doctors remain the most trusted source for medical advice, pharmacists and pharmacies clearly emerge as trusted and regularly consulted health professionals. Trust in pharmacists is especially high among older adults, indigenous population, and those in rural areas. Rural Albertans have a high trust in pharmacists as a primary health resource. This is reinforced by wait times being double in rural areas than they are in urban centers. While indigenous communities reported higher trust and usage of pharmacy compared to the general population, they are more likely to experience stigma when visiting a pharmacy compared to the general population. Younger Albertans are less likely to visit a pharmacy and less likely to always visit their regular pharmacy. They also have lower satisfaction with certain aspects of their pharmacy interaction, specifically lower levels of comfort and ability to understand the information provided by the pharmacy team. Younger Albertans also have a stronger preference for online services compared to other groups. So when asked what they expect from their pharmacy in future, the top 3 answers from the public today and averaging about 36% who responded said that they want faster prescription filling and pickup. 35% say that they're able to say being able to order prescriptions online, and 35% say better coordination between the pharmacy team and their doctor and other healthcare providers. We also collected other comments from respondents, and here are a couple of those examples. A rural resident from southern Alberta said, "I value the convenience, but I want a system that sees me as a person, not just as a transaction. In rural Alberta, that connection is our lifeline." And here's a quote from an Indigenous respondent: "Safety isn't just about the right pill. It's about walking into a pharmacy and knowing I won't be judged because of who I am." So that gives you a little bit of an insight of the material that we collected, and that is where we are today. The next portion of this is where we are going. Now, to talk, we're going to request our President of Council, Patrick Zucker, to come on stage and take it over from here. Thank you very much, everybody.
No, I don't want your papers. I want my papers. Okay. How am I gonna do that? Okay, so moving on from what we gathered, the important part of well, first of all, thank you, Murtaza. Collecting data from surveys, interviews, and environmental scanning was the first step for ACP's planning for the next 3 years and beyond. Next was figuring out what this information is telling us and provide some insight in what we need to do next. So we built our plan, as always, with quality and safety as our guiding principles, which are central to our vision of healthy Albertans through excellence in pharmacy practice. Our plan reinforces the importance of ensuring safe, ethical, and competent pharmacy practice grounded in a continuous quality improvement mindset. It recognizes that this care must be provided by talented but strained pharmacy professionals in a world that continues to rapidly evolve. In the past, ACP has developed 5-year plans to guide our work. This time we made the plan shorter at 3 years, aiming to be nimble and adaptable as we progress through it. In healthcare and in pharmacy specifically, things are changing rapidly, so the need to be able to evolve the plan as needed is there. 2 key considerations that come through our information gathering included conditions of the workforce and the pace of technological change. When it comes to workforce conditions, heavy workloads and staffing shortages continue to challenge the profession's capacity. ACP must protect the public while supporting regulated members to sustainably deliver safe, high-quality care. For technological change, rapid advancements in virtual care and artificial intelligence create new regulatory challenges and risks. While ACP does not regulate technology itself, the college is responsible for ensuring that regulated members use technology appropriately and ethically. ACP is also exploring opportunities for AI to enhance internal operations and services delivery, not system delivery. Where did I put it? Vision for the future, basically, it's a modern, future-ready pharmacy sector where pharmacists and pharmacy technicians are fully integrated into Alberta's primary and preventative healthcare system. ACP will enable an agile, innovation-minded regulatory framework that supports pharmacy professionals in consistently delivering person-centered care. Once all of this was determined, ACP developed 3 goals: elevate pharmacy's role within Alberta's healthcare system, enable quality care in pharmacy practice, and anticipate and support the future of pharmacy practice. So let's just look at, let's look at the 3 goals in more detail. So goal number 1, we want to elevate pharmacy's role in Alberta healthcare system. So pharmacy professionals have an important role to play in primary and preventative care. The public interest is best served when pharmacists and pharmacy technicians practice to their full scope for as many Albertans as possible. This goal focuses on system factors that support strong pharmacy practice and day-to-day operations. This includes exploring new team-based care models and using data to plan for future workforce needs. The goal also looks at workforce challenges such as job stress, recruitment, and staffing levels. It addresses access to pharmacy services for underserved communities, better integration of pharmacy into primary care, and the role of the public in accessing and expecting high quality care. I'm talking past the slides. Here we are. So what does success look like for Goal 1? Greater public recognition of pharmacy as a source of primary and preventative care, increased public trust in pharmacy teams, increased pharmacist assessment and treatment of common health conditions or concerns, and positive patient experiences at the pharmacy. Goal number 2 is enable quality care in pharmacy practice. So the college expects pharmacy teams to consistently provide quality care to Albertans. So this goal focuses on practice level conditions internal to the pharmacy, including making best use of regulated members' skill and scope of practice, continuing to build on professionalism and quality improvement efforts, and ensuring that standards reflect evolving roles. The success for Goal 2 would be practice environments that better allow for consistent delivery of quality care, positive indicators in quality and safety reporting data, and pharmacy teams see ACP as a proactive partner providing valuable resources and guidance. Goal number 3 is anticipate and support the future of pharmacy practice. So, I keep saying so. Healthcare technology and innovation are changing quickly. New tools such as artificial intelligence, virtual care, new types of medications like biosimilars, point of care testing, and improved diagnostics have changed how healthcare services are delivered. While ACP does not, again, regulate technology itself, the college ensures that technology is used properly to support safe and effective patient care. ACP will prepare for regulatory needs created by new technologies. It will build flexibility within its processes and clearly explain expectations for professional judgment when pharmacy professionals use new technologies to provide care. What does success look like for Goal 3? Access to care is facilitated by new technology and practice models that do not sacrifice the quality of patient care. Younger Albertans engage more with professional pharmacy services, and patient experiences and outcome data informs new uses for technology in different care models. So those are our 3 goals, overall goals that we will be working on over the next 3 years. The question is, how do we get there? I'll now ask Registrar Brad Wilsey to come up and walk us through that.
Thank you, Patrick. Thank you, Murtaza. Welcome, everyone. It's great to see people in person, and welcome those online as well. These events, I look forward to them so much because it's one of the only opportunities where we have an opportunity to get to meet in person and talk pharmacy. And I know that's exciting to everybody, otherwise you would be at home doing something else. So anyways, welcome. And my section is about how will we get there. So Patrick shared the 3 overarching goals that we developed from all the inputs, all the information, all the surveys, the focus groups, from registrants, the public, and we boiled it all down to those 3 goals. He then went through and talked about how success would look around those goals. And so now it's my job to sort of walk us through what we're going to do about that and how we're going to get there, which is a bit of a tall ask at the moment because we don't have a whole bunch of clarity on that yet. We've got some, and I'll share what we've got, and we'll share more as we move through the process. But we've been working on this plan for some time, so this is a little bit of a work in progress, but I'll share where we're at and more clarity to come. So what we did is we took the 3 goals and we established some objectives for each one of those goals. And then those objectives and the goals were approved by council. And it was our job at ACP to develop work plans around how we can achieve meeting those goals. And so we put together some objectives around the goals. And so goal 1, if you recall, Patrick mentioned that it's to elevate pharmacy's role within Alberta's healthcare system. The objectives, we've got 4 listed. The first one is communicate clear expectations to the public for pharmacy services. So this is really a public engagement strategy, and it would include a gap analysis to understand what the public currently understands and expects of pharmacy services, and where is there unmet needs that exist among the various groups of Albertans. And Patrick and Murtaza did talk a little bit about that. The rural Albertans, the Indigenous populations, younger Albertans. So the engagement strategy would then be targeted to specific audiences of Albertans. The other piece that would be really important with this public engagement strategy is that it's going to be educational for the public around expectations. And then the next thing we're going to do around the communication piece is we're going to improve the public area of our website to allow the public to make informed decisions about choosing their pharmacy. So to begin with, this could be something as simple as listing, the language availability at a pharmacy. So if there's an Albertan that would prefer to have services delivered in a certain language, they might be able to find that off our website. So that's something that's going to be a work in progress for us, and it was one of the elements to this first objective. Objective 2, we need to assess job satisfaction and how it can impact quality and safety in delivering patient care. So this would involve creating a bit of a feedback mechanism with pharmacy professionals to review workforce conditions, practice pressures, including staffing challenges and work environments, and determine how these issues impact quality of care and patient safety. And while we're doing this, there's other jurisdictions that have done some work in this area, so we're going to obviously reach out to them and do some environmental scanning and partnerships to understand what sort of steps they've taken in order to deal with this issue. And so we hope to learn from them along with developing our work plan for this particular objective. The third objective under the first goal is to address system factors and external conditions that affect the delivery of person-centered care and identify the appropriate regulatory response to address these factors. So in order to do this, we need a better understanding of the role of pharmacy in primary care, again, what gaps currently exist in the current system, and whether pharmacy professionals are or can fill those gaps. So we're going to start by improving what kind of data we have to collect and how we can report on and review that information. The fourth objective, monitor and address risks to self-regulation, including eroding public confidence in institutions, government actions, divergent regulatory practices. We certainly have had a lot of government intervention in our province within the last 6 months. We've had a number of bills introduced that have a big impact on health regulators. Bill 13, the Neutrality Act, for example, is going to require us to revisit virtually everything that we have done at ACP, including our standards, code of ethics, some of our program areas, our website. Likely won't impact practitioners, but it's going to have a big impact on the work we're doing at ACP. So it's just one example of government intervention where there's significant significant impact and zero opportunity for consultation. So something that we need to be aware of as a self-regulating profession to make sure we do a good job and don't ask the government to come in and intervene on us. So goal number 2, enable quality care in pharmacy practice. This is the goal that's focused on work within the pharmacy as opposed to the system factors for goal 1. So the objectives for goal number 2, first one would be to determine how unmet needs in primary care could be addressed by pharmacy teams. So this involves a comprehensive review of the roles of all the practitioners and unregulated employees working in the pharmacy. And further, it's a fulsome review of our pharmacy technicians' scope of practice, how to best utilize it in practice, and what expansion of scope opportunities may exist for pharmacy technicians, and of course, any leadership opportunities for those professionals as well. So it's a review of the health system needs to explore new opportunities for pharmacy professionals. The second objective, expand and improve continuous quality improvement tools for pharmacy teams. The third objective is to share quality and safety trends with regulated members and the public to increase understanding of the elements of care. So for these 2 objectives, we're going to develop quality and safety indicators that can be shared with pharmacy teams in order to better predict risk to patient safety and quality of care. And again, there's a need to identify sources of data that can be used to create and analyze risk-based measures and those metrics that support high-quality care. And while doing this, we'll review the benefits of sharing this type of data, risk and quality indicators, with pharmacies to increase awareness of what good care looks like. And then we can decide how to share this information amongst pharmacy teams. The last objective under this goal is to identify opportunities to incorporate empathy, timeliness, and clarity in regulatory processes. So we'll gather feedback from regulated members to better understand how you experience ACP and consider changes in the way we deliver our services to improve your experiences with us. Goal number 3, anticipate and support the future of pharmacy practice. The objectives for goal 3 are to monitor technological trends and risks through regular environmental scanning and reporting of new technology use in healthcare. We're going to work to create a hub within ACP to capture innovations in regulatory and pharmacy practice. And then we'll use that hub to prioritize potential responses that may be required by ACP. And the second objective is to provide appropriate regulatory guidance for new practice models. So we're going to build out a structured process to evaluate practice innovation proposals, including technology and practice. And our evaluation will include things like patient experience, patient need, alignment with standards, outcomes, and of course the level of risk. And then we'll develop our own process for analyzing and adopting new technologies for internal ACP use. So technology use in and outside of the organization. Objective 3 is to increase our understanding of and adapt to the public's experience and expectations for the use of new technology in delivering person-centered care. We heard from Murtaza that there's a significant percentage of Albertans are interested in technology and how to use it to support them in their health care. So we need to tap into that and increase our understanding of what that means. And the last objective under Goal 3 is to assess the frequency of pharmacy services currently occurring outside of ACP's regulatory framework and address associated risks to practice and the public. So this is identifying pharmacy practices and delivery models that provide services to Albertans that are outside of the ACP regulatory framework. So that's a look at our 3-year plan. As you can see, there's a large requirement for collaboration and partnerships throughout this plan. And I'm happy to see a lot of the organizations in the audience this evening, RXA, PTSA, the Faculty of Pharmacy, CSHP, and other interested parties. We're going to be reaching out because this is a plan that we can't do all on our own. It's going to require some additional support. In addition, we'll be reaching out to the public and to pharmacy professionals for additional information and feedback. We've heard a few things, and we need to find out a few more things in order to inform how we're going to be able to make any responsible change in those areas. And then there's also a requirement for developing and analyzing data. You would have seen in a lot of the different objectives where we need to have data to support decision making. So there's an element of that as well. So we look forward to having you along this journey with us. It's going to take some work. We've got 3 goals that I think are pretty lofty and broad, and they've got some longevity to them. I mean, we've got a 3-year plan, but I think the goals are going to outlive that plan for sure, and it'll allow us to just keep building on it. And at the end of it, we envision that modern, future-ready pharmacy sector where our pharmacy professionals are fully integrated into Alberta's healthcare system. And then we envision an agile, innovation-minded regulatory framework to support pharmacy professionals in delivering the great care that they can deliver. So with that, I think we should take a short break, and then we can come back, and it's going to be a free-for-all for you. Try to be nice.
Good evening, everyone. My name is Barry Strader. I'm the Communications Director with ACP. Welcome to everyone here in Edmonton and those of you participating online on YouTube. We're very glad you chose to spend your evening with us, and we're going to get started with our discussion panel. And joining me up here are the 3 gentlemen you heard from earlier tonight. We have Murtaza, we have Patrick, and we have Brad, all here to take some questions for you, talking about what we learned tonight through our surveys and our focus groups that we conducted last year, and then what we plan to do with all that information with our new plan for the next 3 years. So we'd love to hear your questions and comments about that. I'm just going to get the ball rolling a little bit, and of course we collected a lot of feedback from regulated members in the public, as I mentioned, and I'll ask each of you up here, starting with you, Murtaza, when you saw the feedback from regulated members, what surprised you the most?
I was quite surprised to, I guess the one that I kind of highlighted a little bit in terms of how the later professionals or the younger professionals who are just graduating are finding that technology is affecting the way they provide care. It's actually a distraction. I found that to be quite an interesting data. Yeah.
You thought it might have been the reverse of that, right?
Yeah, I was expecting, because I have seen my students, I've seen the younger pharmacists look, talking to patients, typing notes at the same time, and they seem to be so much well versed with that. I'm still the good old write down on the notepad kind of a guy, so you do see that difference. But and even adoption of new technology, just from what we see they seem to get it faster than a lot of the old folks. So that was quite surprising.
Okay. How about you, Patrick? Anything that surprised you when you saw what we learned from the regulated members' experiences out there?
I don't think anything necessarily surprised me in the results. I think we've been hearing the comments and the survey responses for years, maybe just the percentages of people that are feeling the burnout. I always knew that there was a burnout there, but the level of which people are getting closer to that I wouldn't say surprising, I would just say higher than I expected.
Okay. Brad, any thoughts on surprises from you?
Yeah, I think a lot of it wasn't surprising, but the information around is it easier or harder to deliver care made me sort of ponder why that might be and whether it was, environment based. So for example, those that found it easier to deliver quality care, did they have better tools? Did they have a different work environment that was more supportive of that? And conversely, where it was more difficult to deliver, is the opposite true? Certainly don't have those answers, but it did beg the question when I saw the data.
Right, and then when we look at the public and what we learned from the public in our survey with them and focus groups, Murtaza, I'll go back to you again. Is there anything that surprised you or stood out with the information we learned from the public?
Again, not so much, but with patients wanting things faster, quicker, that makes sense. It's becoming difficult with things like central pharmacies and all that kind of stuff where people have to wait in urban areas. We're seeing a lot more pharmacies pop up everywhere. So for sure, the need for quick service, but is that at the compromise of safety? Question there.
Okay. How about you, Patrick, from the public's perspective?
I always knew that young people, and I'm no longer one of them, I knew that the drive for technology and being able to access care remotely or everything on the phone, I always knew that was there, but the fact that a lot of young Albertans, don't access care because of the fact they physically have to go somewhere, I guess that was a surprising piece for me. And figuring out how healthcare as a whole can access these youngsters to make sure that we're giving them access or giving them the ability to access care without necessarily having to physically go in every time. I think that's an important and impactful piece of the survey for me.
Okay. Brad?
Yeah, I think I was a bit surprised by, again, the younger Albertans and their sort of impressions of trust with pharmacy services. I was somewhat surprised that our Indigenous peoples have very high levels of trust in the profession, but still feel significant stigma in the pharmacy. So I found that surprising. I wouldn't have expected that from our profession. So, those were probably things that just off the top of my mind that made me wonder.
That stood out, yeah. So if you have a question here in the audience in Edmonton, I invite you to raise your hand. We have a couple of mic runners in the crowd. We have Jeff over at the far side here, and we have Jasmine over in the back. And I see we've already got a question there. So, and ask you to stand up so we can see you.
Hi, Teresa Hennessy. Seeing how you were talking about the survey results, I'm hoping you can help me recall, and I may not have this correctly, but I seem to remember that you were looking specifically for regulated member feedback of individuals that worked in community pharmacy practice for that survey. So is it representative of the entire profession, recognizing that even as pharmacy technicians, the majority do not currently work in community pharmacies? And how was that considered when setting the strategic plan in terms of the environmental scan? How else did you look at the representation from that perspective?
Hi, Teresa. Thanks for your question. It's a good question that you ask. I think there was certainly, if I recall the survey questions, likely a definite slant towards community practice. However, interestingly enough, today we were working on some of our initiatives and work plans around the strategic plan, and we had that very conversation about, when we look at scopes of practice, we can't just look at community practice in isolation. We have to look at hospital practice as well. And I had a good conversation with Margaret just on the break here with, discussing the same thing, is that the intent certainly is not to isolate any particular group of our profession. We're looking at, healthcare globally. And when we look at roles and scopes, we're looking at it globally and fulsomely. So, while it wasn't specifically mentioned in what was shown here today, certainly our initiatives will capture some of that stuff. And, as we work through some of this, as we go through some of this work, we're going to be interacting and, getting feedback and have participation in working groups from all the sectors that, so we make sure that we cover everything appropriately.
Great. I've got a question here from our YouTube audience here, and I'm going to say this is probably a Brad question, so I'll direct this one to you, Brad. I thought I heard a comment about a government-mandated change coming that is going to impact ACP greatly. Did I hear that? And could you talk about that a little bit? I'm assuming they mean the Bill 13 piece. So maybe go into that into a little bit more detail, Brad, and how that will impact ACP.
Sure. Thanks, Barry. Appreciate that. And thanks for the question from whoever asked that. So prior to Christmas, we had 4 bills that were introduced in the legislature, 9, 10, 11, and 13. 13 is otherwise known as the Neutrality Act. And so basically, the essence of Bill 13 is that you have to, as a regulatory college, you have to remove any reference to any DEI initiatives. So when you consider our standards, our code of ethics, our website, some of our prescribed learning, we've been fairly intentional with introducing those topics over the last several years. So what it's going to involve for ACP is to go back through all of our standards, codes of ethics, website, programs, required learning, and remove all reference to any sort of DEI initiatives. There's other things in there as well where you can't basically take someone to discipline for outside of work activities unless the behavior is very nefarious. So it's otherwise known as the Jordan Peterson Act. So that's sort of some background around it. It's an incredible amount of work for the college, but as I mentioned, it shouldn't impact practitioners very much. It's just a lot of work for us. We have until next February of 2027 to get everything submitted to government because the coming into force date is August of 2027. And they need that amount of time to go through and approve all the documents that we send in, all our standards and codes of ethics. And keep in mind when you do any changes to standards or code of ethics, there's consultation periods required. So you have to send them out, get consultation from your members, which is you folks, and also from other health regulators, and then the government. And so all that work has to be done. Initially we thought, well, this is kind of good because there might be some housekeeping things we can do in our standards to clean things up. And then we were very quickly told by government that no, that's not what this is about. This is very specific to only Bill 13. And so if you have other things you want to do in your standards, it's a separate submission. So it's going to create a ton of work for all the regulatory colleges.
We also have a question here from the audience that was handed to me earlier, and I believe this is in regards to our third goal about the future of pharmacy and technology. How does ACP anticipate achieving the goal of online prescription services and the challenge of separating the product and the service? I don't know who'd like to tackle that one. Murtaza, you have any thoughts on that one? Patrick?
I think when you look back at our virtual care standards, part of that is already captured in there. Now, evaluating the demand from the public, and again, I reference those young Albertans that would like to do a lot of things online. How do we balance understanding that when we're doing our care, it's person-centered, it's wholesome, meaning we're looking at the entire individual and everything around them. So yes, there's a product focus, which we're always going to be part of in pharmacy. We always have to make sure we're providing a service with respect to the product. But the service over top of that is the important piece. So where does that goal match up with what people are necessarily looking for? And I think we still have to look at it from the perspective of it's important that we're providing that wholesome, person-centered care. Yes, product, but also it's packaged with the care. So it can't be one separated from the other.
Murtaza?
Yeah, I think one of the challenges that I've always faced is how we market ourselves. So when we come out as be it prescribing pharmacists, then right away there's an expectation to prescribe and deliver that. So I think it comes down to how we must make sure that people understand that we're there to assess. And when the assessment is correct, then the product comes in. And regulated professionals should be held towards that assessment being the piece. And public education comes with that. So if public starts understanding that online doesn't mean getting the product, and unfortunately, we do have quite a few of online activities that really start off by saying, call us and you get a prescription, right? So almost the assessment piece is lost. So we need to make sure that the public gets to understand that first.
Yeah, we showed the statistic earlier of those Albertans who have ordered prescriptions online. I think it was roughly half of them had no interaction with a pharmacist at all. So that's a sobering thought right there. Just a reminder, we are taking questions from the audience, so please put your hand up. Oh, we have one here. And for those of you taking part on YouTube, feel free to submit a question through the chat as well. We'd love to hear from you.
Hi, this is Wael. Again, I follow up about these online services and more, and more younger Albertans need to get more online services. Are you expecting to, like, online pharmacies similar to what Amazon doing in the States, like, can be here anytime soon? Are you receiving any requests from similar entities to have pharmacies in Alberta? I am starting to see more directions from some insurance companies and the employers for the insured people to get their medications most of the time from out of provinces online pharmacies and to be right delivered to their places. Are there any rules governing this, especially when they are told they can get more coverage if they are doing this, or unless otherwise they will get less coverage, especially of the fees at the pharmacies, which actually I faced after one of my patients has to transfer online to a pharmacy in BC, and he was not satisfied about the service, and when he's coming back to me, I found all the fees have been consumed already for the entire year, and I have to dispense his medication with no fees covered for him. So are there any rules governing this?
Okay, so there are two questions I picked out there. There's one was maybe Brad for you. Have we seen any interest from any of these entities to have purely online pharmacies here in Alberta?
Well, we get requests quite often, and we get inquiries, I would say. Typically, what we see is we get inquiries, and once we explain what the requirements are, they tend to disappear. Now, whether they actually continue to offer services from another province, it's something we're not aware of. We know what happens. We know men's health is particularly a problem. We're limited by what we can do within our jurisdiction, but it is a big problem. It's a huge safety issue. None of those medicines show up in the electronic health record. So you have somebody that attends an emergency department and is getting a lot of medicines online from out of province. Their profile doesn't have anything in there. So it's a huge risk to patients. I think probably our virtual care standards is one of the reasons why we have a lot less of it in Alberta, because we have requirements around forming a direct patient care relationship. And it's really tough to do that if you're just purely online. So we have some mechanisms in place to sort of, I don't want to use the word protect, but at least the integrity of our system, because if you know, these operators that provide out-of-province services, like I said, there's nothing in the electronic health record for what's being prescribed to these patients.
Okay, we have a question over here.
Thank you. You'll hold it. Thank you. I'm sorry. Hey everyone, my name is Deepak. My question is to do with the data that was, shown today with the survey. So, and the question was asked whether, were you guys surprised to see the data? And, if you ask me, I would say not only that I was not surprised, it was actually a bit of a reassuring. The reason I say is, as right now I'm talking to a lot of the regulated members, for my campaign for council, I get a sense of a bit of a regulatory burden. That, and Bertazza, you showed that, top 3 challenges are managing workflow and there is burnout there. I understand ACP's mandate is to protect the public, and I get that. But in the process of doing that, are the policies we are putting out in place, or the regulations and the standards we are putting out in place, is there maybe a sense, or do we think there is a regulatory burden that we are putting on the regulated members, which kind of acts as a barrier to the patient care? So maybe there needs to be a balance between that there's enough workload or regulatory aspects there, but then at the same time, there is enough time to provide patient care as well. If that makes sense.
It's a great question, of course. And maybe Brad's a little bit better in terms of answering the details, but I mean, I'll speak maybe as a pharmacist too, and I'll think of approaching that. That initially, ACP comes across being a regulator. Sometimes we look like the bad cops, right? Like that. There's a general feeling about that. That we're here to monitor you. And as pharmacists, and pharmacy technicians, we are trained to become independent thinkers, making best decisions for the patient. We are adapting all the time in the decisions we make. And then you have, or the feeling comes in that there's a big brother watching over you and telling you how to do things, and that's sometimes not taken well. And maybe I felt a little bit of that before I joined council, and I think it's you have to make a genuine effort to understanding the importance of being a regulatory body and why it needs to be there. I think after joining it, I really came to understand that it starts, first of all, that a lot of us who open pharmacies, licensees, creating those good habits is extremely essential. I think once you and your team fall into that idea of doing things the right way, then it becomes much easier to be within the regulatory confines. But if we start on the wrong footing and years pass by and basically, our ACP comes probably about every 3 years or 4 years into your pharmacy, changing those bad habits sometimes become difficult. So it becomes a challenge when, all this burden falls upon and becomes burdenous. So first of all is creating those good habits. But at the same time, one thing that I want to say is that being self-regulating, it's an important thing. And if that's taken away from us, meaning that we are no longer making the decisions for our profession, I think that will become even more burdenous, because at least at the end of the day, you want people who are regulating you to be pharmacists and pharmacies who are in the work environment. They've seen what it takes to be there and are making those decisions for you. We've seen in other provinces where the regulatory bodies have been removed or been merged with other professions. Things are changing out there. And at the end of the day, when we speak to those bodies or speak to pharmacists from other provinces, the burden doesn't become any less. Sometimes it becomes harder. So at least today we are here. All of us have a sort of a pharmacy background. We can understand what you're going through. And we've walked through the same challenges that you are feeling. And when we come to council, we don't forget that. So I think that's important to note that we have that in mind too.
Brad?
Yeah, I think, thanks Murtaza for your comments there. It's really about balance when you're, speaking about regulations. I mean, you want to be enabling, but you can't be too enabling. You need to have the right regulations in place so you can protect the public, but you don't want to be overly protective. So, what we attempt to do is strike the right balance so that you get both. And sometimes it's hard to 100% get that right. But if you look at our plan, and we've got, I think in goal 2, there's an objective in there to, assess our processes. And so that's our commitment to sort of look at it and say, are we hitting the right balance? Are we working to get the right balance in place there? So I think there is exactly what you described is in this plan. So thanks for the question. And before I turn my mic off, Jeff is sitting in the middle here. And Jeff, do you have any comments on the online piece before Margaret asks her question?
The online piece as it relates to virtual care standards?
Yeah, just the previous question, because Jeff did a ton of work on this, so I'm just fortunate to have him in the audience today, and we've got some of my other colleagues in here as well. But I just see Jeff sitting right there, so I thought I would turn it over because he's probably got some great things to say on this topic.
Yeah, no, I think when it comes to online care and virtual care, one of the key things is really around the patient preference is part of what the pharmacist needs to consider in delivering that care. And so at times it may be appropriate to deliver that care online, and at times or virtually, and at times it may not be appropriate. And so, what the virtual care standards really do is enable that delivery of the virtual care where appropriate, as assessed by you, the pharmacist, or the pharmacy technician in some cases. So I think that's kind of the foundation with which those standards are built.
All right, and we have a question over here.
Oh, thanks. Thanks, and thank you for the virtual care standards. It certainly made our work easier in AHS because we were doing some of the same work, so it was good. My name is Margaret Gray. I work for Alberta Health Services, and I've got a question, but I'm going to start with a comment because Brad lovingly referred to me earlier. And I think it was important to share with everybody that it was interesting looking at the goals that have been created because I know certainly it was not intentional, but with the focus being on primary and preventative health, there was silence about acute care and the important work that is done by more than 50% of the technicians, as Teresa's already alluded to, and probably about 20% of pharmacists. So knowing that work is going to be inclusive looking forward, I think that's important. But I think it's important to say out loud that it feels wrong when you look at it, when those of us that work in acute care don't report to that ministry even. So just of note. The question I had actually had to do, one of the things, when you guys were each talking about what surprised you, one of the things that surprised me from the public survey was the high number of people that reported knowing what pharmacists did and what technicians do and what assistants do. Because my immediate thought to that is, well, did anybody test them? Because I'm not sure that's true. And I do think that there is a lot of opportunity for us through ACP, as practitioners ourselves, to do better. I think there's a ton of opportunities if we can get our technicians working to full scope, our pharmacists working in full scope in the work that they can do. And it doesn't mean that you won't have assistants in your pharmacy, but having the people doing the job that they're supposed to be doing, I think there's a ton of confusion when a member of the public steps up to the counter and it may be an assistant that's writing down some of the information. They disappear to the back. It might be a technician that comes back with their prescription and calls back to see if the pharmacist needs to come up and talk. So who is everybody and what are their roles? And I don't think we're very good at telling people and, more importantly, showing people the work that our healthcare professionals do. I spent years telling people when they asked what a pharmacy technician does, I told them they do what you think a pharmacist does. because what I do is not what you think I do. And I think we have to find ways in the work that ACP has done in promoting and working with our community practitioners, because one of the ways I think you work against burnout is getting people in the work that they should be doing, not the work that they're left to do. I think that was a question, wasn't it? Sorry.
Question.
If I can just speak to a little bit of that, goal number one, I think some of the objectives around that encompass this piece where we want to make sure that the public understands what they're getting when they go to a pharmacy. You know, expectations have to be set and then achieved. And I think right now the expectations going into a pharmacy can be anywhere from I'm going in, I'm getting a product, I'm leaving, and I want to be in and out in 5 minutes, to this is my healthcare provider. So we need to make sure that there's a clear delineation of what they're getting, or what the minimum level they should expect when they walk into a pharmacy. And that can be their experience in community, that can be their experience in hospital, that can be their experience in long-term care. So making sure that there's kind of a, how do we flesh that out, I guess, would be the way that I would start that. But that, to me, that's part of goal one.
Okay, we have a question from our, speaking of online, we have a question from our online audience. How can we help ACP push towards a national healthcare record, which would help eliminate some of these electronic record gaps we're seeing, particularly the PPNs out of BC and Ontario and in Men's Health, as you mentioned, Brad. So regulated members want to know how they can help push this initiative to make it national.
Well, that's a good question. I think working with government is the way you make change, particularly politicians. They had, I mean, we've just seen they killed Prescribe IT, but then they've resurrected, you know, some conversations around creating that national health record. That's a mammoth task. There's so many players, there's so many technologies. Each province has their own electronic health records. The integration of that is immense. Is there a willingness to do it? There might be in some of the federal ministries, but you know, the only way to really make that kind of change is to really be in the offices of the politicians, in my opinion, and talking to them about the value that it brings to the system. I think there's lots of good data on that. I mean, we've got a fellow that works at CPSA, Ewan Affleck, and he's done all kinds of great work around you know, the disconnected health system and how much money is wasted every year on not having health records that, you know, coexist. So it's a big issue, and it's a mammoth task, though. And so it's like anything in our landscape. If you want change, you have to advocate for it. It's not enough for just ACP to do it. It's not enough for RXA to do it. We all have to take and play a role in that. And every single one of you has an MLA that you live in their constituency, and you have MPs. So, you know, if you're passionate about it, have conversations with them. And you never know, somebody might just grab a hold of it and take it forward.
Okay, we have a couple minutes left. We have a question up here. Jasmine, if I can get you to come down. Right up here, yeah.
Hi, everyone. My name is Yusuf. I'm a community pharmacist. I just wanted to circle back to an earlier question about online pharmacies and also preferred networks. So I wonder if there's a common thread between something like Prescribe IT and those preferred networks where ACP may have a role to defend prescriptions as non-proprietary or open source documents, and whether ACP could intervene to defend commercial viability as a way to protect patient care.
Yeah, thanks for that question. The PPN issue is a very difficult national issue. We have been doing a little bit of work behind the scenes on that for some time now, just kind of keeping track of what's happening, particularly in Ontario. But as we learned recently, even in Ontario, where they thought they had some things in place to be able to manage PPNs, they hit a stop sign. And recently had a conversation actually this morning with some of my NAPRA colleagues, and I was told that the Ontario government has actually told the Ontario College of Pharmacy to slow down on PPNs. So it's an issue that's far from over, and it's national. So it's concerning for all the same reasons we talked about before, with incorrect medical records and patient choice being jeopardized, all those things. So it is in our list of objectives. So it'll be something that we continue to keep an eye on and look for areas where do we have some regulatory influence on these things? Is there something we can do with our regulatory levers to dissuade or solve some of the issues around PPNs? Not a great answer, but I just don't have a great answer.
Time for a couple more questions. So we have one here from Jeff.
You got to stand up. Introduce yourself for it.
Hello. I was just wondering, with the information that was presented and patients looking for more convenience-based care, so wait times were obviously important to them, likely with how society is trending, with wanting things right away. When you're reviewing the other standards with Bill 13, is there going to be any review of the virtual care standards and taking into account potentially what the public wants as far as convenience-based care versus the current standards that are more written for extenuating circumstances for virtual care?
The short answer, Brittany, is the government's made it really clear that there's no opportunity for anything that falls outside of items related to Bill 13. So it doesn't mean that we're not going to review standards, because it's, as in a regulatory environment, you can't, it's very difficult to keep pace. It took us, I think, 3 years to do, Jeff would know better, but 3 years to do our last set of standards that we released a year ago, and more time up front than even that. So by the time you release stuff as a regulator, you already know there's pieces of it that are out of date. So, we have a commitment that we'll review our standards on a regular basis and look for opportunities to improve them. So that's a commitment that we've made internally to do that. It can't go with this next review with Bill 13. So realistically, is the government going to look at anything other than Bill 13? Probably not. So our opportunity for any kind of standards review that require consultation is going to be a couple of years away, probably.
Okay, we have time for one more question. Do I see a hand? Yes, I do.
My name is Rajib. I'm the last question maker. Am I right? Okay. So this is regarding the clinical practice, the prescribing practice of the pharmacist. Our understanding is the patient is getting, more and more kind of interested in this practice. We understand the ACP's directive that the patient shouldn't understand in the first place that this is a medical clinic, which we are quite aware of. Instead, having that in mind, the same patient is coming repeatedly because the first thing worked, he's coming for the second, she's coming for the third. So the practice, the prescribing scope is going beyond and beyond, right? I understand the difference between the pharmacist own competence to go and, kind of help patients. But like our capacity to do that, is it limited by patient's own primary care provider? Or like we can go and help patient obviously from our own confidence, and then we also want the ACP to set some kind of, what is in your mind, are you setting further directives to, make this practice go beyond and beyond? So the bottom line of this question is that, do you have any further plan to increase the scope of this prescribing practice for the pharmacist in next 3 years? After you heard from the other healthcare providers that what pharmacists are doing.
Yeah, I can say a thing or two on that. So to understand your question, you're saying, well, we know we do have in Alberta one of the widest scope of practice at this point. And it really comes down to giving you the privilege of calling yourself a professional, which basically means that you need to be able to draw the line to your own expertise. So we have pharmacists who work in very specialized care settings, be it cross-cancer, hospitals, and they're dealing with one particular subset of disease states, and they really become specialized in that. And they're capable of basically managing a patient for as long as they need to. And I think that's where we were talking about earlier, that our regulatory framework tries to make sure that we are having that balance between patient safety and some control as to what pharmacists can do. So in this case here, I think we need to appreciate where we are, first of all, with the scope. And when you talk about increasing scope, I mean, at this point, I see us having the ability from a prescribing opportunity, really can prescribe literally anything apart from our NARCs and stuff like that. But that allows you to continue as long as you're assessing the patient and you feel confident enough in terms of the care you're providing, and as long as you're corresponding with other healthcare professionals involved in that person's care. So I don't see any limitations there. So I feel like you can do what you feel comfortable with, and there's no reason for us to step in to create that limitations when there are people who are confident in doing what they can continue doing.
All right. Excellent stuff. I would like to thank everyone here in Edmonton and those who have participated online for your participation, for your thoughtful questions, some good discussion tonight. We really appreciate you guys coming out. Thanks to Brad, Patrick, and Murtaza for the presentations earlier and for taking those questions. Again, we really appreciate everybody taking the time to be with us tonight, and we hope to see you again at our next ACP Connect down the road. Have a great night, everybody.